first,
Go
okay.
right.
First, I want to say thank you for the opportunity to speak with you all this afternoon. We had a great presentation this morning, and there were some great questions that were asked. So certainly, if you have questions, I welcome those either during the presentation or at the end. You can either, as Cynthia mentioned, unmute or put them in chat, and we will address those. So again, thank you for the opportunity to speak with you in regards to annual enrollment for 2022. So just kind of an overview of what we're going to see in 2022. It was initially projected in working with our consultant that we might see approximately a 5% increase to premiums. We fortunately were able to mitigate that down to about 2%. And feel pretty good about that. If you look national trends, increases are anywhere from 6 to 7%. And certainly we've heard in the media, or you may have heard in the media recently, concerns of employees experiencing significant increase. So we're glad we could keep it at about 2%. In order to do so, there are a few changes. One, we're moving to what's called a balanced drug formulary. And I'll speak to that point in the next slide to further clarify. We're also adding a program called Livongo for hypertension. It is a hypertension management program. If you're familiar with Livongo for diabetes, in principle, it's the same type of a program. Then we're also going to see slight increase in employee contributions, and I'll directly share those changes with you during this presentation as well. So in addressing that change in the balance formulary, that will impact 25 Langston participants. Blue Cross Blue Shield will reach out directly to those participants who are impacted by this change and help them with that change and what it means with them and their plans. And those communications will be received on or before 11/1. So if this change in formulary will directly impact you, you will receive a direct communication. The change in balance formulary, basically what it does is moving some higher cost prescriptions to lower cost options that have the same chemical structure. So same type medications, just a lower cost prescription. It will also change some drug classes from higher tiers to lower tiers. And then it'll also exclude some drugs from coverage, but primarily those are over-the-counter drugs, so things like antacids that we can just go and we can purchase over the counter. So those are the primary changes. And once again, if impacted, you will receive a direct communication on or before 11/1. So looking then at the health plan design itself, so we're talking about our Blue Options PPO plan, and then as well, we'll talk about our Blue Edge, which is our high deductible health plan. We are not seeing any plan changes in 2022. I won't read through all of the numbers on the slide, but I will focus on the in-network deductible, as well as that in-network out-of-pocket maximum. So it will help us be better consumers of our healthcare. So if we're using those in-network deductible, that will stay the same as $850 for individuals and $2,500 for family. And then your in-network out-of-pocket maximum will stay at $5,000 for the individual plan and $15,000 for family. Also want to address the change and where it says prescription drugs, because I have received questions regards to CVS and Target pharmacies being considered out of network. That was not a new plan design change this year. It actually came into effect last year. So this isn't something that is new, but they will remain out of network in 2022. And again, this is for our Blue Options PPO plan. For our high deductible health plan, Blue Edge, also see HDHP, no plan design changes there as well. So the deductible, and it's both in-network and out-of-network, will stay at $2,800 for the individual plan, $5,600 for family. The out-of-pocket maximum will stay the same in terms of in-network and out-of-network at $6,900 for the individual and $13,800 for the family. We will continue offering the HSA employer contributions at $750 for the individual plan and then $1,250 for the family plan. In saying that, the IRS came out with an increase in total contributions, and we'll talk to that later on in the presentation. In terms of prescription drugs, again, CVS and Target pharmacies are considered out of network. So our plan design in 2021 will be exactly the same in 2022. You'll receive the same benefit.
Whitening and this and that.
In terms of premiums, I know it is of interest to employees. And looking at the PPO, which is that blue options plan, we're seeing a $10 increase to employee only, employee children, and employee spouse, and then a $15 increase on family. And that's both for the Blue Options PPO plan and the Blue Edge HDHP, that high deductible health plan. So for annual salaries less than $45,000, the employee premium will be employee only on the PPO at $75, employee plus children, $474.02, employee plus spouse, $623.64, and family coverage will be $1,177.28. For those employees then with an annual salary greater than $45,000, the employee only coverage will be $160, employee plus children, $559.02, employee plus spouse, $708.64, and then family coverage will be $1,262.28. For our Blue Edge high deductible health plan, for annual salaries less than $45,000, employee only will be $356.30. Employee plus children will be $378.94. Employee plus spouse will be $388.84. And family coverage will be $420.20. Then for the Blue Edge plan for annual salaries greater than $45,000, employee only will be $160. Employee plus children, $542.10. Employee plus spouse, $668.44. And then family coverage will be $1,136.66. So those are the annual premiums per month in 2022. And looking then at our premium credits, the premiums on the previous slide were not indicative of the premium credits. So we will continue to offer the same premium credits, one being the Catapult Health Screening, which after completed, an employee becomes eligible for a $20 per month premium credit. For those that are new to Langston and or maybe have not had the opportunity to engage in a Catapult Health Screening, any screening that is completed after July 1, the premium credit is good for the remainder of the year and then the entire following year, so the entire year of 2022. If you're somebody that schedule does not permit for you to engage in an in-person health screening and or you would just prefer to get the screening at your primary care provider, that is absolutely acceptable. There's a form that you can access, take to your primary care provider. They complete it, submit it to Catapult, and then that premium credit will become effective that first of the following month. So that's an option if your schedule does not allow for an in-person screening. We also will be continuing to offer the tobacco-free affidavit, which is that $20 per month benefit. If you are somebody that has previously used tobacco products, you might want to review the eligibility because it will be actually listed in open enrollment. If you've been tobacco free for a period of time and or you've engaged in a tobacco cessation program, you can become eligible for this credit as well. So you might want to review those eligibility requirements. So we'll continue to offer up to $40 premium credit opportunities in 2022. Also want to mention health management reminders. These are part of your benefit packages that are not necessarily considered medical, dental, or vision, but they're opportunities that you would have to engage that might impact your health in a positive manner. So want to just mention those briefly. So one is Ovia Health. Ovia is our prenatal support program. Pregnant women who complete Ovia actually can earn a $250 premium, or excuse me, deductible credit. That's a deductible credit. So I want to make sure that pregnant women are aware of this program. We'll also continue to offer Livongo for diabetes, as I mentioned earlier. And on the next slide, we'll talk a little bit more about Livongo for hypertension. Also want to briefly mention the Benefits Value Advisor, as that is a program that you are eligible for and you can access it. The number is on the back of your Blue Cross Blue Shield benefits card. It can help you navigate the healthcare system and become a good consumer of your benefit packages. I also really like to continue or to frequently remind people of the Benefit Value Advisor, especially if somebody has to complete an MRI or a CAT scan. There's a $100 fee associated with those procedures. And if you call the Benefits Value Advisor, that they will waive that $100 fee. So everybody's aware of that, and you might potentially have the opportunity to put money back in your pocket. Also want to follow up on that. I've gotten the question periodically: if I access services with a Benefits Value Advisor, do I have to go to a provider that they refer or recommend? No, you do not have to do that. You can go to the provider that you choose. This is your benefit plan, even if it's not one that they refer you to, and you can still earn that $100. You can have that $100 fee waived. So I just wanted to make sure everybody's aware of that. And again, these are non-emergent MRIs. That fee does not apply if it's an
value advisor.
In terms of Wonder Health, some of you, this is really not a new program. Some of you are familiar with the weight management or weight loss program, Naturally Slim. Wonder Health is Naturally Slim reimagined. It is involved to a more holistic program, more than just based on diets and nutrition. Also, I want to tell you that that's not a typo. There's no E in Wonder. They have dropped the E from Wonder. So that is actually how it is spelled. And we'll continue offering that in the spring, in the summer, and in the fall. Also, I know there had been a limitation for some individuals because the timing of the program didn't match their schedule in terms of when the program started. It now has what we'll call a revolving start date. So as soon as a participant is accepted, they're eligible for the program, you can begin that program. So I think that's very much a positive that will help work with some of our schedules. We will also continue to offer Hinge Health, which, as a reminder, Hinge Health is that chronic pain management program designed to help employees minimize the chronic pain they're living with and potentially prevent surgical procedures. I actually earlier this week received an unsolicited email from an employee who had such a great experience with Hinge Health. He thought he was going to have surgery, and he was able to. He's been engaged a few months with the program, able to minimize and or eliminate his chronic pain. And it was just such a great program for him. Hinge Health provides chronic pain management program for necks, shoulders, back, hips, and knees. And yes, when I say that, every time I want to say head, shoulders, knees, and toes, like we all did when we were in kindergarten, right? But no knees, no toes on this one, so I can't do that. So we will offer all of those programs. And just as a reminder, these are of no charge to you as an employee participating in any of these programs. So to speak to a little bit about Livongo for diabetes, Livongo for hypertension, as it is new in 2022, it's really same in principle and theory as Livongo for diabetes, in that it has that two-way cellular connectivity. It will share testing results with physicians. They will provide real-time feedback if testing results are out of target zones. They will send reminders. Participants do receive a blood pressure cuff to test their blood pressure. If you're not familiar with that term hypertension, we're talking about what's considered the silent killer or high blood pressure. So we will be offering that free for employees beginning 2022. Okay, switching focus a little bit, talking about our flexible spending accounts and our health savings accounts. We will continue to offer the health FSA as well as the dependent care FSA or flexible spending account. The IRS has not come out with any guidance as to whether these contribution maximums will change for 2022. Certainly, if we receive those communications, we will make you aware as soon as possible. The maximum for the health FSA is $2,750. And then the dependent care FSA, the maximum is $5,000 per household. And that is for child care up to age 13. That age is different. Some of you may recall that due to legislative changes from COVID, they actually increased that last year. So I want you to take note that that was decreased back down to what was pre-COVID, with the age being up to age 13. Also different than historically, the carryover for the health FSA and the dependent care FSA will go from 2021 to 2022, and that's all unused funds. There's not that limit like we've seen in the past of $550, but it's all unused for both of those accounts. I also want to speak to that in terms of those maximum contributions. Those are not impacted by a carryover. So if you have a carryover, it won't reduce your health FSA maximum from $2,750 or your dependent care max for $5,000. It was kind of add to it, if you will. In terms of the health savings account, again, must be enrolled in the Blue Edge high deductible health plan. You also can't be on Medicare, and you can't be claimed on somebody else's tax return. We did see an increase in total contribution for the employee only. It was a $50 increase. So the employee maximum contribution increased by $50 to $2,900. And then employee dependent, the maximum employee contribution increased by $100 to $6,050. In terms of the contribution limit, the additional $1,000 for those that are age 55 or older, this isn't a change. It's consistent with what we saw in 2021. So those are our FSA and our DCA accounts, as well as our health savings accounts. In terms of dental, we will continue using Delta Dental of Oklahoma as our dental provider. We will continue with the 3 plans that we had in 2021 for 2022. So there'll be that low option, the high option, and the platinum option as well. Won't read all of the numbers on the chart in front of you, but looking at the difference in the benefits, one is the per calendar year annual maximum. It goes from $1,500 per person on the low option, $2,000 on the high option, and to $3,000 on the platinum option. Also a difference is the coverage of orthodontia. The low option does not cover orthodontia. The high option covers orthodontia up to 26 years of age. And then the platinum option covers orthodontia throughout the lifespan. So there's no age limit on that coverage with the platinum plan. Also with the platinum plan, that covers nitrous oxide. It covers teeth whitening and additional cleaning as well. There are no plan design changes in 2022, and there's also no premium changes. So the premiums for 2022, for the low plan, the employee will be $34.80. Employee plus spouse, $68.94. Employee plus children, $79.18. And then family coverage, $122.44. The high coverage then, employee only, $42.26. Employee plus spouse, $83.86. Employee plus children, $122.98. and the family plan is $159.16. Then, of course, with our platinum option, additional coverage, so there's a slight increase to that premium, which is the same as last year. Employee only, $69.24. Employee plus spouse, $137.82. Employee plus children, $205.42. And then family coverage, $266.32. So again, those are the same premiums that we saw in 2021. For vision coverage, we'll remain with VSP as our vision provider. We'll also continue with the same two plans, the base plan as well as the buy-up plan. I know there's a lot on this slide. The one point that I really want to speak to is in your bottom right-hand corner, because I want to make sure everybody's clear on what the coverage for that buy-up plan, and that these are an or, not an and. So those in the buy-up plan are eligible for one of these plan upgrades, either the frame allowance, the contact lens allowance, the premium progressives, or that anti-glare reflective coating. And it's one of those in the plan year. Just want to make sure that people are clear and you're choosing the plan that you feel like is most appropriate for you, and that there's not a misunderstanding that all of those are covered in the same year. And saying that, if somebody had the coverage in 2021 and they chose one of those plan upgrades in 2021, they could choose that same plan upgrade in 2022, or they could choose a different one in 2022. That's an option as well. So again, we'll stay with the VSP. We'll also continue with the same premiums as we saw in 2021. So our basic plan, employee, $5.98, employee plus spouse, $11.98, employee plus children, $12.82, and family coverage is $20.48. Looking at that buy-up plan with this additional plan upgrades, employee only will be $10.70, employee plus spouse, $21.42, employee plus children, $22.92, and family coverage, $36.62. So again, same premiums as we saw in 2021. Looking at other coverage, we will continue to offer MASA ambulance coverage. When you're looking at the premiums of $14 and $39 per month, $14 is domestic coverage, $39 is global coverage. And it does cover ground and air ambulances. So it's both of those. So you can enroll in MASA ambulance coverage when you're electing all of your annual benefits. One point I want to share is making sure when you're electing MASA coverage, it looks a little bit different than when you're electing your other benefits, in that you have to select your dependents at the time you're electing that MASA coverage, and you'll click on those dependents. They'll actually turn the color of green, and that means that they're added to your ambulance coverage. Again, that looks just a little bit different in the portal, so I wanted to make sure that you are aware of that. Life insurance, we're seeing no life insurance changes from basic life and AD&D or accidental death and dismemberment. The maximum coverage will remain the same, that it's equal to 2 times the annual salary up to $200,000. We'll also be offering the same supplemental life insurance as we have previously. An employee can increase or enroll their supplemental life insurance for themselves up to 4 $10,000 increments. So it's a total of $40,000. And that's if they're not at the guaranteed issue limit, or there has been no prior denial of an evidence of insurability or an EOI. In terms of supplemental life for spouse, employees can increase or enroll during annual enrollment by 1 $10,000 increments for spousal life. And again, the same parameters in that if not at the guaranteed issue limit, and there's been no denial prior to of an EOI. So wanted to share that information with you as well. Want to just briefly mention as an overview, not all of benefits will carry over. So you'll want to ensure to engage in the annual enrollment process. What will not carry over are your flexible spending account contributions, your dependent daycare account contributions. So you'll need to make those elections and put the amounts in. Your health savings account will not carry over as well. Already mentioned that tobacco affidavit. You'd want to continue to do that every year so you can earn that premium credit. Strongly encourage, even if there's no intent to make changes to your health, your dental, or your vision, to confirm those benefits, to review those benefits, not only at the time of annual enrollment, but I think it's important to look at them as well after the first of the year. Look at your pay stubs and ensure that you have the coverage that you have intended to elect. Because we want to make sure these are your benefit plans, and we want to make sure that you have what you feel like is most appropriate for you. We want to also make sure that dependents are verified as through annual enrollment. The only changes that can be made during the year are due to qualifying life events. So we want to make 100% sure, if at all possible, that everything is accurate and reflected as you intended. As Cynthia mentioned at the beginning of the presentation, annual benefits enrollment is November 1st through 12th. So that's coming up next week. And you'll have the opportunity at any point during the day to enroll in those benefits, whatever is convenient with your schedule. And you can go in and make changes at any time during this 2-week period. So if you think you've decided what your election is, a couple days later, prior to the 12th, you want to make a change, you absolutely can go in and out of that system, in and out of the portal, and make changes during this annual benefit enrollment time. No issues or concerns there at all. So I think at this time, I'd be happy to I think Cynthia has some additional information she would like to share with you, and then we would be happy to take any questions that you might have.
Perfect. Thank you so much, Rachel. Colleagues, if you would like to type in any questions you have for Rachel in the chat while I'm going over my few things, she'll be able to respond to those. And again, if you have any that you just want to share or come off mute, you're welcome to do that as well. But a couple of things that I want to remind everyone is that benefits enrollment is for everyone. Everyone needs to go out and review your benefits for 2022. You need to make sure all of your benefits are the way that you want them to be. You need to recertify your tobacco-free credit. So it's important that everyone completes benefits enrollment November 1st through the 12th. And so please, everyone, do that. If you have not completed your Catapult dates, there are 3 remaining dates that Catapult will be on campus. So you have 3 more opportunities to get that done here on the Langston campus in the Allied Health Building. Those dates are November the 4th, November the 11th, and November the 18th. So you can go to your Langston email address, type in Catapult, one of those messages that have been sent out by public relations, go to that link and schedule your Catapult visit now for November 4th, the 11th, or the 18th on the Langston campus. Oklahoma City and Tulsa employees can go to OSU OKC or OSU Tulsa. Employees who are not, who desire not to meet with Catapult in person but want to have the form completed by your doctor, you can go again to that PR message and get that form, or you can email me directly and I'll send that form to you, that PCP form that you can send to your doctor, have them complete and mail it into Catapult. But it's important that you get that done because you're going to get that credit for 2022. So be sure to do your Catapult as well. Now, American Fidelity. American Fidelity will be on the Langston campus Monday, November the 8th from 8 to 5 on the 2nd floor of Page Hall in the open area. They will be in Oklahoma City, November the 9th, and they'll be in Tulsa, November the 10th. And so Langston employees, we are used to them being on our campus maybe 2 or 3 days, but they will be here one day. They have limited availability this year, so November the 8th from 8 to 5 for American Fidelity. If you miss them on the 8th, you can certainly connect with them in Oklahoma City on the 9th or in Tulsa on the 10th. And if you're not able to go to those campuses, you can certainly connect with me and I can connect you with them while they are available on our Langston campuses. Now, colleagues who have a flexible spending account, very, very important. Remember that the minimum that your FSA can be is $300. Last year, we had some people select less than that amount, and we had to go in and make some adjustments. So the minimum is $300 for the year for your FSA. If you have an FSA, it's very, very important. The FSA enrollment is a two-part process. You have to meet with American Fidelity and you have to make the benefit election in the portal. So again, this is a two-step process. We had a number of employees who did one or the other, but not both. You have to make the election and benefit focus and meet with American Fidelity, because American Fidelity still has a paper process with that FSA. So please be sure to complete both processes, and please remember the amount that you entered. We also have people make the election and benefit focus, and then for one amount, and then they meet with American Fidelity and they forgot and they changed the amount, then we had to go back and make those adjustments. So jot that down and make sure that you meet with American Fidelity and you complete your FSA in benefit focus. The next thing is MD Live. Many employees are taking advantage of MD Live, but if you're not, MD Live is an option where you can meet with a board certified doctor through your phone, your smart tablet, your computer. On the back of your Blue Cross Blue Shield card, it has a number for MD Live. So if you feel sick, or if you have a spouse who's on your medical insurance or a dependent who's on your medical insurance and they don't feel well, you can connect with them at home. I think it's a $10 copay if you have Blue Options, and then a $40 copay if $44 if you have Blue Edge. But you can meet with the doctor, board certified doctor, anywhere in the United States. You can meet with the doctor, and then you don't have to leave home. And it's very convenient, especially during the pandemic. You may need to go to visit with a doctor, but don't want to go to the emergency room or hospital. You can use MD Live. So if you haven't used that, certainly use that option as well. They can write you a prescription, your family member picks it up, and you stay at home resting. Potential retirees, if individuals who are looking or considering retirement for 2022, it's important that you make your benefit elections in now for 2022 based off of what you want to have and carry over into retirement. Because when you retire, at the time of retirement, you can only use those elections that you currently have active. So if you're planning to retire in 2022 and you know you want to have medical, dental, and vision, it's important that you make those elections now in November, so you have all of those elections in 2022. So I want to keep that in mind and remind all those who are considering retirement. And then this is also a good time to update your beneficiaries. And so life happens, things change in our lives. We need to update our beneficiaries. Oftentimes, individuals, we hope that no one is getting a divorce, but sometimes that's a part of the process. If you do get a divorce, be sure to, and if you have, for example, life insurance, supplemental life insurance on that spouse, but you have gotten a divorce, that person is no longer your spouse, and you have to remove them from your supplemental life insurance because they're no longer eligible for that. Or if you still have them on any of your plan options, medical, dental, and vision, you need to remove those individuals at this time as well. So things to think about. If you need to update your beneficiaries, contact us. We can get you those forms so that we can update our beneficiaries. We never want to think about those types of things, but we do want to be responsible for those family members who are going to be handling our business for us. Unfortunately, we had some current employees who have to pass, and it's important that you have your HR documents updated. So I want to remind you about that with your update, to update your beneficiaries. And then lastly, the elections that you're making now, November 1st through the 12th, in January, please check your January pay stub. Make sure that your elections are the way that you want them for January. January is the best time that we can make any changes. For example, with Catapult, you can have completed Catapult with them in person, receive the email that you satisfied the requirement, but your $20 credit not be there in January, because systems work when they work, and sometimes with the fee, things happen. We want an opportunity to fix that. It's easier for us to fix that in January than fix that in March or April. So be sure to check your beneficiary elections when you get your pay stub in January. Any problems or issues, we can work those out in January. It's important that if you selected benefit focus, Blue Edge, what you meant to do, Blue Options, all those types of things, let us fix that in January and not later on down within that year. So those are the main things that I have for everyone. We will look at some of the questions in the chat as we begin to wrap up the meeting. But if anyone had anything that they wanted to come off mute about, we certainly can look at that as well. One person did ask a question. This is going to be a question from Rachel because I don't know the answer to it. If you enroll in Livongo, will that enroll you in Livongo hypertension and the diabetes collectively or separately? Rachel, can you answer that for us?
Absolutely. That is a fantastic question. They are two separate programs.
Excellent. So if you're interested in both of those programs, you will need to enroll in the hypertension program and the diabetes program. A lot of employees taking advantage of the diabetes. Now we have hypertension. Let's take advantage of that one as well.
And there's no limitation. I should also mention, it's not as if you can only enroll in one or the other. It's absolutely appropriate, if indicated, to enroll in both simultaneously.
Excellent. And I think the rest of the questions, Rachel has already answered those. Appreciate that, Rachel. This tag teaming is really, really working.
One question, Cynthia, I wasn't thorough. I was afraid I might misspeak, is where do you prefer that they sign up for American Fidelity appointments?
So you don't sign up for American Fidelity appointments. You just need to come to Page Hall. Great question. Just need to come to Page Hall on the 8th between 8 and 5, and American Fidelity will be there. Open area of Page Hall to meet with employees. So it's on a first come, first served basis. So just come by and they'll be there all day to meet with everyone. So it's important that you meet with American Fidelity to make sure that your benefit elections, all your elections are the way that you want them for 2022, because as Rachel said, some things roll over, but some things don't. And you need to be sure to meet with them to make sure that your elections are correct. But great question. Any other questions?
Yes, I have a question.
Go right ahead.
So, Rachel, you mentioned that for the FSA, that it will carry over from 21 to 22.
Correct.
Do we know about the 22 to 23?
We do not know. The IRS has not come out with any guidance at all in regards to carryover from 2022 to 2023.
Okay. Thank you.
Yeah, that's a great question. I had that question myself. Are we going to know that? But we don't know yet.
It's kind of good to know because you're trying to use all those funds, between either the end of the year or that runoff period. And so I was just curious about that. So thank you.
Yeah, that's a great question. It would be great to know that. Yeah.
All right. Well, colleagues, thank you so much for your time. Thank you for joining us on today. We had record numbers at our first session, record numbers today. I want to thank Rachel for joining us on today. Rachel and her team helped me out tremendously behind the scenes. I'm not able to handle all that I have to do, and Rachel and her team handle all of our coding and the questions that I don't know. They help me with that, so I greatly appreciate her for joining us on today. Colleagues, so oftentimes you can think of something maybe an hour or two later from a presentation. If you think of something, email me at csbuckley@langston.edu. We'll be glad to answer any questions that you have at that time. For those who would like to keep entering questions in the chat for Rachel to answer, please do that. But we want to get you in and out of the way on today. So again, November 1st through 12th, annual benefits enrollment is that time of the year. Thank you so much, colleagues. Enjoy the rest of your day. Thank you, Rachel.
Thank you.
Bye-bye.
Thank you.
Thank you.
Thank you. You're welcome.